You're on.
Okay, well, good morning, everybody. Welcome to our special City Council meeting. Today is Friday, April 17th, 2020. It's approximately 9:32 a.m. We're coming to you via video conference. Before we begin, if you'd like to join me in the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, so the first item is a conflict of interest statement. I'll ask if any member of the City Council, City Manager, or any member of the City staff has any known conflict of interest on any item on the agenda.
None, Mayor.
None, Mayor.
And if I may, can I ask who's present? I see Councilor Ford and Councilor Baker-Stuvey. Who else is here?
Cassandra Gondeta.
Cassandra, okay.
Good morning.
Councilor Vasquez.
Okay, good morning, everyone.
See me? I'm here.
Oh yeah, no, I saw you. Okay. All right, so first item is going to be 2.1, Resolution 20-146. Need a motion and a second, please.
So moved.
Second.
Cassandra Gondeta.
And okay, and who seconded?
Gabe Vasquez.
Okay, motion made by Mayor Pro Tem Gondeta, second by Councilor Vasquez, and Mr. David Dollahan, Assistant City Manager, will begin the discussion.
Good morning, Mayor and councilors. Before you is a budget adjustment resolution to address the impacts of COVID. I hope you can see my PowerPoint screen.
Yes.
I can.
All right, let's see if it'll go to the next slide. Oh, gotcha. As you'll recall, March 11th, the state of public health emergency was declared by the governor and the Secretary of Department of Health for New Mexico. At your April 3rd special meeting, you had a resolution under 20-132 where you allocated a little over $1 million to address COVID issues in Las Cruces. Then again, at a special meeting on April 10th, you passed a further resolution for an additional $684,000 toward this cause. We, the community, are still experiencing the threats to our health, safety, and well-being and property of our residents because of COVID. This resolution allocates $139,500 in emergency assistance from the general fund. As was outlined in your packet, if you want to use something other than the general fund, you're well within your rights to amend the exhibit and change the funding source. Outlined within the resolution, coming from Fund 1000, the general fund, a transfer to the Affordable Housing Trust Fund, Fund 2013, in the amount of $65,000 for Mesilla Valley Habitat for Humanity. It is being proposed for completion of construction of 5 ongoing homes that are under construction, that they are going to have to hire private contractors to complete the construction. Because of the pandemic, they're unable to use a volunteer corps at this time. We've met with Habitat earlier this week, and based on their estimates, this is their biggest priority for now, is getting those 5 homes completed that are already under construction. The second item on the list is $1,000 from Fund 1000 to be expended within the general fund. That's the $74,000. Sorry, I have a typo there. $74,500 back to the Economic Development Department. That's the previous allocation for the microloan technical assistance that you approved under last week's resolution. And then from last week's resolution, it takes the $74,500 back from the TELSOR fund and puts it back into fund balance. We feel like it's more appropriate that the economic development microloan technical assistance come from the general fund and not from the TELSOR fund. So that's the basic premise under that. Sorry about the typo on the second item listed at $74,500, but I believe it's correct in your packet. And you have your standard options, Mr. Mayor, members of council.
Thanks, David. So basically, the money that originally we were thinking of using the Telshore Fund for Mesilla Valley Habitat for Humanity and the microloans looks like can be, instead of necessarily using the Telshore Fund, looks like we can do it in-house, one through the general fund, the other one through the Economic Development Department, basically.
Yes, sir, Mr. Mayor, both these for Habitat and for the ED microloan technical assistance would come out of the general fund. The technical assistance would be spent by ED directly out of the general fund attributed to that department. The Habitat for Humanity would come from the general fund and be a transfer to our Affordable Housing Trust Fund and then allocated under an agreement to Habitat for Humanity. It's a better accounting of how the money is used and the sources that it's coming from.
Sure, not a problem. Okay, Councilor Vasquez and then Mayor Pro Tem have questions.
Thank you, Mayor. Thank you, David, and good morning to everybody. Yeah, I think these funds are much better expended out of the general fund than the Telshore Fund, at least for the time being, given what we've told our constituents we're going to be using the Telshore Fund for. I just have one request. I support both of these requests, but I would love to hear an update on both of these items at a future work session in the form of a presentation, perhaps by Mesilla Valley Habitat for Humanity. I would love to see. I mean, this is a great program, tremendous nonprofit. I've volunteered my time to help them on a house build myself, and I think it's a terrific opportunity for homeowners to finally reach their dream of being homeowners. But would love to at a future work session perhaps meet the homeowners or just get a presentation of how the funds are expended, what kind of work Habitat for Humanity has been doing in our community in the last couple of years. I think our constituents would benefit from knowing the great work that they do. And then additionally, with the microloan program for the Economic Development Department, would love to see in a reasonable time an update on how that particular program has helped local small business owners after it's been rolled out, or what the function essentially of this program will have achieved once it's completed. Because if it's a successful model, I would love to continue something like this even post-COVID, because small businesses are having a hard time getting access to capital and have been for a long time. And so I'm glad that the impetus for doing this is now, but also if this is something that we can continue to do as a city to really strengthen our small business community in the future, not in a pandemic or an emergency situation, would love to explore that option as well. So those are my two requests, and I'm supportive of this resolution. Thank you, Mayor.
Thank you, Councilor. Mayor Pro Tem.
Thank you, Mayor. Thank you, Mr. Dallahan, for the presentation and for the comments of my colleague, Councilor Vasquez. I very much appreciate the conversation with Habitat. I think they do excellent work. One thing I'd like to remind folks is that I'm sort of on the fence about pulling money out of the general fund and not from the Telshore Fund specifically for Habitat for Humanity, because we've had discussions about using our Telshore Fund for housing opportunities. And so I just want to make sure that we have the appropriate funding available given the COVID and probably the decrease of the GRT, according to Dr. Paredes and Dr. Martinez. So I guess my question is to Leanne and others, from that fund, what is our current balance, and do we have anything new to report as it relates to revenue loss, that this would be an issue?
Mayor, do you want Leanne to chime in on that?
Oh, sure, if she's available.
Good morning, Mayor, Councilor. This is Leanne. As you can look in your packet, and if you'll remember at the last council meeting, we took a resolution to you for our, it's sort of our late mid-year because we were also taking our adjustments for our approved audit by the state. And if you look on page 7 of 10, after your required 2/12, we have an available balance in the general fund of $15 million. So I feel, and actually I had this conversation with, with the Assistant City Manager, Barbara De Leon, and also with David Dollahan, and I feel reasonably confident that this 15 million we can take care of this with putting the Habitat for Humanity in here. We also feel budget agrees with the assistant city managers that this is a really good area to put it in and not put it in the Telstar. We agree with those as well.
But Leanne, I think Mayor Pro Tem also wanted to know a balance on the Telstar fund. I'm going to guess that's about 34 million after you take out more or less what we have distributed or what we have removed, because we took a pretty good loss on that stock market. I think we lost about 4 million on that one.
So Mayor, if you look on page 10 of 10, now of course this is, using accrual accounting and accrual budgeting, but there is an ending balance in there of about 42.4 million in there. I will tell you, I am been talking with the treasurer, Karen Byram, because she is she's the one that actually invests this money. I think the last time that we talked to her, me and Assistant City Manager Barbara De Leon, she was anticipating an estimate because she had not received the actual investment package back. But she was estimating that we were probably, because of the stock market, in the SIC, which is the State Investment Council, that particular fund, we were seeing probably a decrease in that fund of around 12 to 14%.
Yeah, I figured at least 10. So, okay. Yes. All right. Yeah. Mayor Pro Tem, was there more questions?
Thank you, Leanne. I appreciate that. I just wanted to be sure that from time that you presented or prepared this, that there wasn't anything drastic that changed. Also, from Dr. Martinez, is there anything that's different from the presentation you did last week you might inform us today? And secondly, I gather that from the presentation last week that this is going to be technical assistance to businesses already. And I don't recall what that process is about recruiting these businesses and who you might be working with as you move through this process with the technical assistance, the micro lending loan.
Good morning, Mayor, Mayor Pro Tem. This is Griselda Martinez, Economic Development Director. Thank you for your questions. The first question is this going to make a difference in the programming? The approach that we had taken after the session last week on how to serve businesses that are being impacted by COVID. We reached out to the respondents, the 2 CDFIs that had responded to our initial request, and we asked them to revise the approach to be more focused on the businesses impacted by COVID in our community. So that would be the only difference. However, in a direct or indirect way, all businesses are hurting from the current situation. So it would still be aligned to the presentation that I made last week. The process would be for us to engage in a service contract with a community development financial institution, the CDFI, and we will follow the procurement process that we have for such services, and we would also follow the performance contract approach that we have implemented for other contracts, which would include deliverables on how many businesses are being served, how many hours of technical assistance are being delivered to the different businesses. And then because one key component is those technical assistance hours transferring to access to capital, how much capital these businesses being served are having access to.
Thank you, Dr. Martinez. If I can interrupt, I think David Dollahan has his hand up, wants to make a quick comment. Or he forgot to put it down.
Sorry. So no, Mayor, sorry. I did have a quick comment. I'll lower my hand now.
Okay.
Going back to Councilor Gondra, Mayor Pro Tem's question about using the Telshore Fund for housing. Historically, we've used that for emergency or temporary housing, primarily in a rental situation. We haven't used it for hard construction in the past. We used it for housing with the asylum seekers essentially last year. So we felt like this was a more appropriate use because it is hard construction money. If we were looking at a different situation like emergency temporary housing, which we funded out of the a little bit out of the first $1 million through Community of Hope and other partners, we would be recommending the Telshore Fund at that time. That's all.
Thank you, Dave. Mayor Pro Tem, you have any more questions?
Thank you, Mayor. I appreciate it. I'm satisfied. Thank you.
Great. We'll have Councilor Sorg and then Councilor Abate Stevie. Councilor Sorg?
Thank you. Yes, thank you, Mr. Mayor. My computer is slow. Yeah, I'm in commenting on Councilor Vasquez and Mayor Pro Tem's comments. I'm familiar with the Habitat with Humanity 2. Some time ago, long time ago, I did do some house building work for Habitat. And there have been many houses in the city that I've helped open up. I congratulated the new owners. It's a wonderful thing to see that. And we've been talking about using the Telshore Fund for more affordable housing now for a long time. And it's about time we move on that, as Councilor Vasquez and the Mayor Pro Tem has mentioned, and using the Telshore Fund to do that. I remember the conference we had at the, I didn't have, the city didn't have, it was some other organization in Las Cruces or the Doñana County that talked about several areas of problems. Transportation and affordable housing were just two of the many. And in the affordable housing, it was concluded that we could afford, we should be putting as assistance close to $1 million. I wouldn't be opposed to even increasing that significantly from the Telshore Fund for affordable housing. So yeah, I think this is a good thing. This particular resolution here is just fine. This small amount coming out of the general fund is just fine with me. Thank you, Mayor.
Thank you, Councilor Sorg. I have to tell you, just if, you know, in my opinion, when I talked about in my State of the City about using the Telshore Fund for funding of affordable housing, I wasn't meaning to take portions of it to build buildings. More so, I was thinking a lot of these housing authorities or nonprofits who build, they can access like 90% of the monies. They have a hard time coming up with 10%. So I was hoping that we would then lend them, let's say, for example, let's say they have a $10 million project. They can come up with 9, they need $1 million. We lend them the $1 million and they pay us back. We just charge them, say, 2 or 3% interest, and they pay us back over a period of 10, 15 years, so that we're slowly divesting our interests. So it's not all in the State Investment Council like it is today. Like you just heard, that we're going to lose 10 or 12% on our investment. And so if we slowly diversify and use that fund for other revenue producing loans, because that way there it'll still maintain its corpus amount while still earning interest.
Yeah, I understand, Mr. Mayor. It's just that we tried that once already with a project and it was not accepted. We need to have projects that are going to be done when we invest that money into them, rather than depend on some affordable housing organization that gets tax credits and all. We need to actually go ahead and with partners, of course, like Habitat, do it.
Actually, I think that project was accepted. It was initially turned down and then reversed by the state finance board. The one from.
Really?
Yeah, it was. It was.
That out there at Metro Park Village?
I don't know if it's a Metro Park. It's a pretty good sized one that Juan Olvera and the public housing, and it included the Attorney General's office, the State Treasurer's office, the State Auditor's office. This is one where they came back and revoted and it passed. So it was a pretty substantial project. I can't remember exactly. David Dollahan might know where it's at, but
yeah, there was 2 projects at that time. One was down around Idaho or Missouri Street, and then the other was out there in the East Mesa off of Peachtree.
No, I know where it is. It's Pecos and Foster.
Yeah.
That they're going to renovate that place. It's a pretty decent sized project. So.
Well, as I understood it, the other one got turned down, and that's what we were going to loan $1.2 million to help it. But anyway,
Mr. Mayor,
it's worked out.
Yes, David.
You're both correct. The one, Desert Hope Apartments, was approved for the tax credits. We have 2 agreements on Monday's on Mondays. We have 2 resolutions for agreements at Monday's meeting. The one out in Metro Verde was turned down.
So let's try to get it done next time some other way. Thank you, Mr. Mayor.
Well, thank you. Councilor Abate-Stubi.
Thank you, Mayor. I want to thank Mayor Pro Tem Gondra for her questions regarding the microloans. I have a question for Dr. Martinez. How soon can we start referring basically businesses over to you to start looking into these microloan programs?
Yes, Mayor, Councilor Abate-Stubi, if you have businesses that are contacting you, what I would ask you to do is to refer them to us as soon as you hear from them. We have other supporting initiatives, and also we could contact them, put them in touch with other service providers. And so if you have been contacted by small businesses, if you could just make that connection, we will be happy to follow up. Specific to the technical assistance for access to capital, we are in the approval process for the contract, and we were pending to have the final decision on the funding source to finalize the amendment from what we have worked before. So as soon as we have the service contract for this work, we would have a big announcement to make sure that businesses are aware of this opportunity. And then we would start immediately with efforts to outreach to businesses through the partnership.
Fantastic, thank you. And what would be the most helpful resources that the businesses would need to bring to you to start this program? What would they need to bring?
You know what, thank you for that question. That's very helpful. And one of the comments that we heard from one of our partners, small business development centers, when they were helping businesses to access the SBA loan, for instance, is that one of the biggest challenges was for businesses to come with all the paperwork needed to be ready for application. And so the details, we could share those with you as soon as we have them worked out with our partner CDFI through this service contract. And maybe that's a good point for us to bring awareness to small businesses that through our email blast, what requirements there may be, or the more frequently asked questions that business have, and for us to share that information. So I appreciate you asking that question.
Thank you, Dr. Martinez. I think that's a great idea to have, and just helping, I think, both parties with that process. I'm very excited to hear that. I'll also be looking to see later on when we do some tracking data about how many businesses were able to help, what those industries ended up looking like, and then maybe even demographics on the owners themselves, on who ended up needing the most help with these types of things. So I'm very curious to see what that process will look like and those types of tracking items. But thank you very much, Dr. Martinez, and thank you, Mayor.
Thank you. Okay, well, thanks for the, oh, Councilor Bencomo, did you have a
Yes.
question?
Dr. Martinez, I just have one quick question for you. I'm curious about, so this money is going directly to the Economic Development Department, right? I'm curious about the 74.5 cap, and if this, like, how did, I know that we've discussed that this was the cap a few weeks ago, and then we extended it to higher. Are these sufficient funds for you? Do you think you'll come back to ask for more depending on how it goes? I'm just curious about how we landed on this particular number.
Yes, Mayor, Councilor Bencomo, this is Cristiano Martinez again. Yes, this number was previous to the change in the cap for funding. What I like to do though is to launch this program and use it as a pilot program. And as you have stated, I am very interested in learning the impact that this is having to help small businesses, and for us to stay flexible to make other potential moves that would support other gaps that we are identifying as we hear from businesses and as we work with partners in the community. If this program proves to be effective and of great impact, we would definitely be coming back to request additional funds. But at this point, we'd like to stay to launch this and stay very focused on monitoring the results, and then be able to adapt to other opportunities if needed and as they come.
That's wonderful, Dr. Martinez. Thank you. Something you said last week when you presented on this that really stuck with me was about the inequities in lending that exist right now for minority business owners and people of color business owners. And so for me, I think it'd be really important to see that kind of data as well, not just the kind of business that you were able to support, but if they were business owners who were historically marginalized and left out of some of these processes. So for me, I think that would be really important. And I just thought it was something really important that you said last week.
Thank you, Councilor Bencomo. We will be including that item as part of our reporting, because it is also important for us, and also considering the demographics of our community, that a large portion of our population is just minority.
That's right. Thank you so much. That's it, Mayor.
Okay, thank you, Councilor. And I think that's it. So if there's nothing further, it's been moved in second. And Christine, if you call the vote, please.
This is on the motion to approve Resolution 20-146. Councilor Abeyta-Stevie?
Yes.
Councilor Vasquez?
Yes.
Councilor Bencomo?
Yes.
Councilor Soares?
Yes.
Councilor Flores?
Yes.
Councilor Gamada?
Yes.
Mayor?
Yes. Great. Thank you. So next is going to be some updates. Last council meeting, we had asked for some information regarding specifics regarding COVID-19. And we have with us from the Department of Health, Mr. Dave Morgan, and I believe also Ms. Dawn Sanchez, I believe. Let's see here. So Dave, you're going to kick it off, Dave Morgan? Yeah, Dave's on the phone, so he's not, we can't see his happy face today. I think he's on the phone. Dave? Okay, well, let's just switch to Dawn real quick. Dawn, are you there?
*6. Right. My apologies, everybody. Thank you, Mr. Mayor. Thank you, everyone. So also with us, in addition to myself and Southwest Director Don Sanchez, is our state epidemiologist, Dr. Michael Landon. A few of you will be familiar with Dr. Landon. He was the doctor who came to speak publicly at City Council chambers to publicly address COVID-19 before, literally days before it really blew up. And Dr. Landon, you with us right now?
Yes, David. Thanks.
Thanks for joining us, Dr. Landon.
Oh, thank you for the invitation.
Okay, so Dave, Morgan, you have some information you'd like to share with us?
David, would you like me to start, or?
Yeah, I apologize. I keep hitting *3 for some reason. Anyway, you know, we're basically here to be able to provide answers to you. So I'll turn it over to Dr. Landon, but then whatever questions you know, Mayor and Council have, we will be happy to tackle them for you.
Well, Dave, one of the big things was whether or not we could get information based on zip code. And I don't know if you've been able to disseminate that information throughout the county. I know some other areas do that, specifically El Paso, Texas. Was that something there that the state has that capability?
Right. Yeah, this is Mike Landon. As I understand it, you all, Dunn County may have received some data, zip code data last night. We had also provided some small area data. So small areas are similar size to zip codes, but are a little more stable. And we have 125 of them in the state and a number in Dunn County. And so, yes, we can provide you all those data in either format. And I had understood that some data had gotten to you by zip code yesterday, but if not, I can double check that. And then we also have small area data, which is a little more of a better area in terms of better population data, so you can do rates and comparisons and stuff like that.
I think the data that I remember seeing was based, and it was good. It was based on ages and a few other things, but I wasn't too sure if I saw zip codes. I may have. I don't know. I've been reading a lot of information. And then the second one was any information regarding Presbyterian, who apparently has a model that could predict either when the surge was coming or what they could predict what the county was going to look like, worst case scenario.
Well, with respect to that, Presbyterian does have a model. Also, Lanel and Sandia have some additional supports to that model. They work with Department of Health on modeling. And the model for the Presbyterian model has a peak currently of May 18th for the state. Now, the assumption is that it will occur earlier in the areas that have been more affected in the Northwest, and later, and who knows, you know, the amount later, maybe a week, that sort of thing, later in the South. In general, the modeling information we look at uses case information, and I can just point out that Dunn County's rate is about 26 per 100,000, which is lower than New Mexico's rate, which is about 67 per 100,000, which is lower than El Paso's rate, which is lower than the U.S. rate. Those are all good things. And in terms of the doubling time of the cases, which is one way we look at growth of the outbreak, doubling time for the state cumulatively has been about 4.6 days. In the last 7 days, the growth rate and doubling time in Diana County have decreased, which is good. So we're not seeing as much growth. In fact, the doubling time in Diana County is substantially less than the doubling time for the state as a whole. So that's all very encouraging. We have a lot of cases in the northwest and central part of the state in terms of the risk is greater for COVID in those parts of the state and lower in your area, and particularly Diana County. The one thing that Los Alamos has been emphasizing in their models is the potential risk of importations and from other states. And El Paso does have a higher rate than Las Cruces, and that is something to keep an eye on, is the risk for importations, because that can sort of affect the modeling. But in terms of the state model, the Presbyterian model specifically, it's on May 18th, it's predicted that the state will need an additional 1,200 ICU beds based on Presbyterian's model, sort of at moderate intervention. If the intervention is cranked up, if the social distancing is cranked up further, that would drop to below 1,000 needed ICU beds. And based on the surge planning, we're looking at hopefully having around 600 ICU beds after when we expand access throughout the state. One thing that's going to affect the model is, and does affect the model, and the model is just a prediction, or the models are just predictions, is social distancing. And the good news for Las Cruces in Diana County is that the social distancing change, specifically measured in amount of miles traveled, based on some data we have from Descartes Lab, is the amount of miles traveled in Diana County has dropped about 43%, which is lower than the state, which is more of a drop than the state, and the lowest drop of any county in the southern part of the state. So you all are doing very well with the social distancing work. And what the social distancing work will do, hopefully, is it'll flatten the peak, reduce the pressure on the healthcare system, and also may move the peak out further. Some national models have suggested, particularly the University of Washington model, have suggested the peak in New Mexico will be around the end of May. End of April, early May. So there are lots of different models out there. One thing that the Sandia model can do, and if you all are interested, we can connect you with the Sandia modelers, is they can look at, based on some of the epidemiology inputs, for example, inputs from the Presbyterian model or the Lannel model, they can then look at, for a particular county, they can come up with some scenarios and some estimates of medical equipment needed, staffing needed, and beds needed. So if you all are interested, I can connect whoever you would like with the modelers at Sandia, and they can provide those specific estimates.
Okay, well, thank you, Dr. Landon. I was looking at the information that was sent to, I believe Councilor Bencomo had asked for some information, Councilor Vasquez, and what was sent the night before, it has it broken down into age, it has it broken down into race, and then the status. And just real quick, if the council, my colleagues haven't received this, of the 51 cases as of April 13th, 1 was African-American, 38 was white, 5 was other race, 7 was incomplete. So, whatever. And then the second thing is, Dr. Landon, is you said maximum 600 ICU beds. What is would you happen to know how many are in the state total?
The number that are available for COVID estimates right now are about 126. And in terms of the total number of ICU beds, the estimates vary, but approximately 350 total. But because of the curtailing of elective surgery and procedures, the amount of ICU beds has actually increased recently in New Mexico. The availability has increased, which is very positive, and people have really, some of those interventions have really helped increase the availability of ICU beds.
Okay, well, we have a slew of questions here. Councilors Beta-Stuvey, Sorg, Vasquez, and then, let me get to David real quick. David Maestas jumped in, and then we'll get to Councilor Flores. So David, you had a quick question?
Yes, Mayor, thank you very much. This is for David Morgan. Mr. Morgan, I know you mentioned that you thought that here in the South there had been information about the zip codes. We have not received that. If you could let me know who that was sent to, I would very much appreciate that so I can get in contact with them. The information that Mayor just read out to us was something that we had received several days ago, and it did talk about some demographics based on the positive tests, but unfortunately we have not received anything with respect to the zip codes.
Yes, sir. I will determine where that information is. I'll work with Mike to make sure that it gets in your hands.
Thank you. I appreciate that, Mr. Morgan. And then, Mayor, I'll go ahead and turn it over to councilors since they were on the list, but I will have a follow-up question afterwards. Thank you.
Okay, we'll do. So we have Councilors Beta-Stuvey, Sorg, Vasquez, and Flores. So Councilor Beta-Stuvey.
Thank you, Mayor, and thank you, Mr. Morgan, Ms. Sanchez, and Dr. Landon. I do have a list of a few questions, some of which, if they cannot be answered now, I'd love to see them given to us in the future. You did answer a few of my items, such as when we were to expect our peak here in Las Cruces. But I was also wondering if we currently have testing processing capabilities here in Las Cruces now, or if we're still having to send those test kits up to Santa Fe.
David or Don, do you have information on that? If not, I have some.
Councilor,
go ahead and
Dr. Landon, yeah, this is Dawn. Right now, we are still sending our test kits up to SLD in Albuquerque.
Okay. And do we have plans on getting that testing capability here in Las Cruces?
There is some of the Abbott tests have been deployed at hospitals throughout the state, and I do believe, and these are rapid tests. They're the same PCR, the same type of test, a PCR test, but it's a rapid test, and I believe those are currently we have them at Memorial and Mountain View.
Okay, thank you. That's good to know. And in regards to testing, I know that we have positive and negatives that we've been able to see. Are we tracking sort of the inconclusive tests? And if so, have we seen any differences in Doña Ana, if we have a higher rate, or is our rate of inconclusives about the same as other places in the state?
We treat indeterminate or inconclusive tests almost essentially like positives, and we keep close track on those. And if I'm not mistaken, we've had very few indeterminate tests, and I'm not aware of any indeterminate tests in Doña Ana County.
Okay, thank you. And are we currently testing our nursing homes right now, even the non-symptomatic?
Yes, Don, I'm not sure. We've done some testing based on symptomatic cases and that sort of thing throughout the state. Actually, a lot of testing, and the planning right now is, particularly in the southern part of the state, the case rates, fortunately, are not as high. As I mentioned, Doña Ana County's case rate is 26 per 100,000 compared to the state case rate at about 66. In McKinley County's, for example, is over 300, just to give you a perspective. So McKinley County's case rate is 10 times that of Doña Ana County. However, we also have noted, and it makes sense, where you test, you'll find additional cases. So we are unrolling out a process to do testing particularly and also in nursing homes throughout the state, including Doñana County, where we'll be testing where there are no symptoms. We'll be doing a representative sample of testing at nursing homes throughout the state, including Doñana County.
Fantastic. I'd love to be able to see that type of time schedule where we in Doñana County are in on that timeline as compared to the rest of the state. And
that would be great. I would just suggest, if I could, Dawn, why don't you touch base with Brianna Henley, who I believe is in your part of the state, and she would have that schedule.
Right. Mr. Mayor, Councilor Stuve, we are ramping up the testing within the long-term care facilities, working with our Division of Health Improvement, who does the licensing for the facilities. Another thing I want to just mention is that the CDC is actually doing a study in Las Cruces in the county, looking at why some of our rates are lower as far as transmission, what behaviors are happening, and they are this week actually going to be surveying and doing some testing in 3 of our long-term care facilities here in Las Cruces and 1 of our hospitals. And then we're following up with a large general population random study come next week at our public health office as well. So we have begun working with those long-term care facilities, and we'll definitely.
Right, and Dawn, if I could just add to that, CDC volunteered some resources to the state. We particularly felt it was important to have those resources focused on a portion of the state without high rates, that is not getting as much attention as the other parts of the state. So we basically planned this assessment with CDC, which Dawn described, which will give us an idea of the prevalence of COVID, just community-based, which is really our first time to get that sense anywhere in the state, and also get a sense of prevalence of COVID and also infection control practices among in the healthcare setting. So I think it'll be very helpful.
Thank you. That's good to hear. And I know as we are learning about this pandemic and learning about the virus itself, that they're finding that there are certain underlying health conditions such as pulmonary hypertension, perhaps diabetes, that are leading to worse outcomes. Are we doing tracking in our state as well about this? Are we noticing any trends in our own community with people with underlying conditions and perhaps other demographics that they may have?
Yes, I mean, we're aware that these underlying conditions such as diabetes, hypertension, other heart disease, chronic lung disease, kidney disease, other diseases that suppress the immune system can all lead to higher rates of complications for COVID. So we know that persons 65 years and older are at higher risk of those complications, hospitalization, and other bad outcomes, so to speak. And then we also know that chronic disease or these underlying conditions can lead to that as well. We are tracking that. Unfortunately, with most of the deaths that we've seen in the state, and we're now up to about 44. We were up to 44 deaths. Most of these have occurred among older persons with underlying conditions. Mm-hmm. We also track that information on all of our cases. So we do have that information, and we can work with you all to get that information for your community.
Thank you. I really appreciate that. And I know, as we age, of course, there's a lot of different things that can happen, and we build up on those underlying conditions. I'll be curious as well to see those outcomes for the younger demographic, if those conditions are different or lifestyles, what might be leading up to that, even, smoker, non-smoker, things like that, just any of those items. So thank you. I'd really like to see some of that.
Right, and then I would just mention one other key, it's not really an underlying condition, it's more of a social determinant, is when we look at poverty, census tract level poverty rates, we do see a gradation, which we see for many of our health status indicators, that COVID does appear to be associated with poverty in New Mexico. I'm sure most people at this meeting are not surprised by that. But, unfortunately, we're seeing that same pattern with respect to a relationship to poverty with COVID infections in the state. So we've just been looking at that recently as well, and that's the advantage of, we use our small area data for that, which is a little more. We're able to look at census data with respect to that in a little more accessible format than we can with zip code. So that's the advantage of the small area data.
Thank you. That's, unfortunately, that's a very big problem for our area, but I'm glad that we are tracking that to see what we can do. I was also very glad to hear that we are looking at El Paso very closely on their data and numbers and cases. That our communities are very much linked, and as their cases rise, that's where we can see perhaps other opportunities for people when we're working with each other and having that relationship where we might get some people crossing over that might be barriers. So I'm very glad to see that we're looking at that. With that in mind, I know that in a lot of our cases, when we have non-COVID related cases that we send to El Paso for our hospitals, that higher level trauma, should we not be able to send our cases there for that, will they be sent to Albuquerque? And if Albuquerque also has a surge at the same time, where and what is the plan for patients here in Las Cruces to receive that higher level trauma care?
So you're specifically speaking of non-COVID associated trauma care, right?
Yes, I know that we send, I think it's stroke patients, other types of situations, they usually get sent out to either El Paso hospitals, or perhaps they could get sent out to Albuquerque. If those hospitals end up at peak capacity to receive stuff, what is the plan for our community to make sure that our residents are still getting that service?
That's a great question. And my assumption, and it's only an assumption, was that the current referral patterns would continue for trauma care, but I will we'll double check on that and we'll let you guys know. There have been some discussions of changing, transfer patterns a little bit with respect to COVID cases, but I have not heard any plans to change transfer patterns for trauma care. But I that's an assumption. I really need to double check that.
Thank you. I'd appreciate that. And just knowing that we also receive a lot of outlying area patients, if we are going to continue to receive those patients, do you have any numbers on what to expect? Even though our cases might be low, do we have plans on what to expect from our rural communities?
Well, with respect to that, fortunately, or unfortunately, depending on how you look at it, Doñana County has one of the higher rates in your immediate area. So even though it's relatively low compared to other rates in the state and the U.S., compared to El Paso, it is higher. Grant County has a rate that's a little bit higher than Doñana County. So in general, the rates of counties around you are lower than Doñana County rates. The plan in terms of referrals for COVID cases, though, does, in the southern part of the state, does center on referrals, potential referrals to the two hospitals in Las Cruces, Memorial and Mountain View. So it's the hub and spoke model, and one of the southern hub is Las Cruces with respect to COVID referrals.
Thank you. Thank you, Doctor. Thank you, Don and Dave, and thank you, Mayor. Those are all my questions for now.
Thank you, Counselor. And just appreciate your comments regarding the nursing homes or nursing facilities. I actually reached out to them this week to see if what they needed, and what they're saying is things are good, but they could always use more masks, the N95 mask, and then alcohol-based hand rub. I'm not sure what that is, but I don't suppose
that's the hand sanitizer that people use in lieu of hand washing.
Oh, okay. And the state doesn't have access to that, do they?
Well, in terms of the masks, the Emergency Operations Center has received some additional PPE recently and masks recently, and they're working to get that out. In terms of the hand sanitizer, Don or David, do you know if we've been distributing any alcohol-based hand sanitizer?
David, I have not.
Okay. And also, Councillor Abeitustuvi, one of the larger facilities have been doing random testing on their employees, and so far, thank goodness, nothing, all negative, so that's good. We're just trying to be proactive on that, and I appreciate your question on that. Okay, next is Councillor Sword. Yeah, Councillor Sword.
Thank you, Mayor. And thank you, Dr. Landon and David Morgan and Don. It's good to hear you again. I just have one main question, and that is that when you test for the coronavirus and you have a positive test, do you determine whether that positive test could be either a community obtained infection or an importation? Because early on in our testing, I heard rumors that there was people from El Paso coming up here to Las Cruces to be tested. And in fact, even one person from Phoenix, Arizona. As far as I know, they have returned to their cities, but I just wondered if you keep track of those two things when you get a positive test.
Yes, we do. After we get a positive test, New Mexico is one of the few states, well, the few states that's still investigating all cases. So we're investigating all the cases. We're interviewing the cases, asking about contacts, and then we do contact tracing around all these cases as well. And so we do track importations, cases that have been basically imported from elsewhere and that sort of thing. And that's a concern that Los Alamos in their risk profiling has raised. Is that something that's sort of a note they've put on with respect to the southern part of the state and Doñana County specifically? We need to keep track of the possibility of importation. So that's a very key thing to be doing.
Okay, thank you so much.
We do track that.
Yeah, I just wanted to remind the rest of the council and let you all know there at the Department of Health that we did get a graph that showed the case summary, that showed the increase in numbers of positive tests, both in New Mexico and Doñana County, and it's quite, it actually shows in a graph form what rates you told us about here this morning. And I just want to make one last comment, how disappointed it is that the hospitals have to lay off personnel there. It's too bad that, in a situation that we're in, we can't keep the people employed in the hospitals, but that's just my comment. Thank you, Mayor.
Mm-hmm. Thank you, Councillor. Councillor Vasquez.
Thank you, Mayor. Have just a few questions here. Earlier, you mentioned that we had one of the lowest rates at 26 per 100,000. I think the latest numbers I saw had us at over 50 per, probably roughly just over 100,000 in total population. So how is that number determined when I think we have double that?
Right. So yeah, sometimes the rates and the way epidemiologists discuss rates can be a little confusing, and I apologize for that. So just to be, so Doñana County yesterday had 4 new cases, had total confirmed cases 58. So if you take 58 and divide it by Doñana County's population, you get a rate per 100,000 of 26.7.
Gotcha.
The Doña Ana County's rate per 100,000, and this allows us to compare, apples and oranges. So we can compare Doña Ana County with a rate of 26.7 per 100,000 to El Paso, which has a rate of, based on 689 cases and a population over 800,000 of 82 per 100,000. So that just gives us a way to normalize that. And we can also compare it, Doña Ana County's rate then to New Mexico's rate, which is about 67 per 100,000. So we use that to look at per capita cases, essentially, and we're able to then establish, different levels of risk. So based on looking at this, we would say the risk of COVID right now in Doña Ana County is substantially lower than it is for the entire state of New Mexico. It's substantially lower than it is for El Paso, and that's a good thing, and suggests that the social distancing work that you all are doing, as reflected in the miles traveled data, working with your community, is paying off.
Okay, thank you. That sounds great. Regarding the peak that you mentioned in, I forget which model it was, the Sandia or Presbyterian, you said the South is expected to peak sometime after May 18th. Could you just repeat that again? What the source was and what the expected peak time was? And if
right. So the model that our core model is the Presbyterian model.
Okay.
And based on that model, the peak is expected to be May 18th.
Okay.
And certain parts of the country are peaking earlier than other parts. For example, New Mexico hasn't peaked yet, but it looks like Louisiana's peaked. It looks like it's likely peaked. It looks like New York has peaked. Washington is likely peaked. So some areas get started on this outbreak or pandemic earlier than others, and therefore they peak earlier. And we're expecting, particularly the northwest part of the state, to peak earlier than the central part of the state, and then the southern part of the state to peak later than the central and northwest part of the state. And this is just an expectation based on the way the virus sort of moves through a population. And so it's an estimate, it's a prediction, but we would expect Doña Ana County to have a peak that's later than the rest of the state. Now, that being said, like I mentioned, other models, such as the University of Washington model, which looks at every state, they're estimating that New Mexico will peak in late April, early May. And with that, thinking along those lines, then the southern part of the state would peak a little later than that, but perhaps a little before May 18th. So it really sort of, I hope I'm not confusing you, but it sort of depends on what model you're working with. But based on our core model, May 18th, peak for the state, and we would expect the southern part of the state, which has seen less activity from COVID, to peak a little later.
So this is a really interesting double-edged sword kind of thing, right? Because on one hand, we have one of the lowest rates probably in the country, lowest rates certainly within New Mexico, and that means that our social distancing approach has been working. That means folks have been paying attention to guidelines and directives, and I'm very proud of that. On the other hand, it means if we don't peak until later, post May 18th, that we have to keep essentially our economy closed for a lot longer, right? And so while other places who have peaked, where peaks have been seen, may reconsider opening sooner, would you have a recommendation one way or the other in terms of as we continue to have a local emergency declaration, but also follow the state guidelines? I think it's important for constituents to know this information, right? In terms of when we're expected to peak and why we keep restrictions in place when we see such low numbers. So do you have any comments on that? I mean, in terms of best practices during a time when we're doing really well, but we're not going to peak until later. So we should probably keep those restrictions in place, I'm assuming.
Right. I mean, I would just say that I would echo what I think the governor is stating, which is, it's too early to talk about changing our interventions at this point. We haven't even peaked. So in the state, and then in particular, we haven't even peaked in the South. I do think, I'm going to be, I think the information we get from the, the CDC team that's doing the sort of the community survey for COVID, I think that's going to be very helpful. It's going to give us a sense that, we do know that asymptomatic transmission is, does occur, or pre-symptomatic transmission in the 2 days prior to symptoms being developed. We do know that that occurs. And the amount of testing in the southern part of the state overall hasn't been as great as some places in the northern part of the state. So that information will be, although testing is increasing in the southern part of the state, that information from the CDC assessment will be very helpful, and I think it'll help your Doña County and Las Cruces to plan.
Great, thank you so much. Looking forward to that data. Glad the CDC is here. So you also mentioned the 1,200 ICU bed shortage that New Mexico is expected to have under the Presbyterian model. Is that also broken out geographically? Is there something we could or should be doing in Doña County to address, to prepare for that, our share of that bed shortage, essentially?
Yeah, I mean, that's a good point. You all are one of the, I mean, after Bernalillo County, you're the biggest source of, or biggest, have the most ICU beds. So I will look into those breakdowns and see if we have anything through our medical advisory team, and get back to you all on that. I'm not aware of any regional breakdowns for ICU beds in terms of expected shortage, that sort of thing, but let me look into that and get back through Don and David that information.
Okay. And a follow-up question on that is, during the peak time where we're experiencing an ICU bed shortage and we're seeing staffing levels currently at healthcare facilities and hospitals being reduced significantly because of the loss of income from elective procedures and other normal business as usual, are we going to have to ask all those folks to come back during an ICU bed shortage or the peak situation? Do you think that our healthcare system is adequately prepared as we're essentially laying staff off, but are anticipating a surge that might require them to come back?
And from what I've heard about the various healthcare systems is that these layoffs are hopefully and likely short-term layoffs, and as needed, they will bring additional staff on as the anticipated surge picks up. So that's the understanding I have, and I don't have an understanding about every single healthcare system. This is mainly hearing from healthcare systems in the northern and central part of the state. So I haven't spoken specifically with, I'm not aware specifically of Memorial or Mountain View's plans.
Okay, thank you. And I have two more questions. One is regarding regular health checkups, or not so much the elective procedures, but things that people do routinely to take care of their health, and appointments that they may have with medical professionals, whether they be at clinics or hospitals that are currently going untreated or unchecked, or appointments are being canceled. I also worry that we are affecting the long-term health of our population because we don't perhaps have some of those preventive health checkups that regularly would take place. And so I also fear that if folks aren't going in to see their regular doctors or physicians for 2 months, that more complications could develop, or that things could come out as a result of people not getting the healthcare services they need. Is that something that you kind of thought about, or that's on the radar in terms of people's regular health services being suspended during this time, and how that impacts the population long term?
Yeah, I mean, it's really Catch-22, we talked about underlying conditions, diabetes, heart disease, chronic lung disease, kidney disease, all those things that increase the likelihood of complications of COVID. We talk about those things, yet, and those are worse when persons' chronic conditions are in, and also, you know, substance use disorders are a big part of that too. When those conditions are in less control, the risk of complications increases further. So there's a catch-22. We're making the healthcare system more ready and prepared for COVID. And the challenge is we are, at the same time, we have affected routine chronic care. So what's really key, and hopefully this is occurring increasingly in Las Cruces, are basically video visits, internet-based healthcare visits, and that sort of thing, which persons, where people who have chronic conditions can get the care they need without risking, you know, getting COVID and really increasing their likelihood of complications from the disease.
Yes, thank you. Certainly hope that the telehealth system is really beefing up during this time, and that folks are using all the services that they need virtually as much as possible. My last question / request is more maybe for staff, but also for the council to consider is, I think with this core model that the state is using, the Department of Health is using, however we can communicate that as localized as we can to the public, you know, to justify the decisions that the city council is making and continues to make. I know in particular, you know, business folks are getting very anxious for the economy to reopen. And I think knowing, for the public to know that we're making these decisions with the best available data that we have out there is an important thing for us to put out. And so I don't know if that's in a form of a press release or the data that's made available on COVID-19 Las Cruces, but I think having, you know, beyond this meeting, letting the public have a general understanding of why we're doing the things we're doing and on what timeline based on the data that's available to us is an important thing that I would like to point my constituents to when they start asking about easing restrictions or relaxing restrictions, so that our decisions are really being supported by the models and the data that are out there, and that they're easily available to the public, if that data is available publicly.
Okay, well, thank you, Councillor. So next we have Councillor Flores and then Bencomo.
Thank you, Mr. Mayor, and thank you, fellow councilors, for your excellent questions. I appreciated very much the questions of Councillor Abeyta-Stube. My concern, my questions, my concerns, my comments are that the northwest part of New Mexico is highly impacted with, you know, San Juan, McKinley, and Bernalillo. They're all very close to each other. And you mentioned tracing, but I'm wondering if there's enough tracing. And I'm also, when you look at the states that are bordering the Northwest, and looking at a map where all the COVID virus is present, there doesn't seem to be a lot of exposure, but then of course they're just little red dots on a map, so, and the numbers aren't there. So that's a, you know, my big concern, well, I think there's a lot of concerns as all of us have. The tracing issue, I don't think there's enough tracing. And the other, and so I would like you to give us more specific information on tracing. The other is the stats that we received about 2 days ago that the mayor and Mr. Maestas made reference to. Showed that there were 30, it had all this breakdown, but I didn't, of ethnicity or race or whatever you want to call it. And I don't know how the stats are being compiled for this purpose or maybe other purposes throughout the state. But I didn't see Native Americans and I didn't see, I would like, I think it'd be necessary, and I didn't see any Hispanics, and I don't know if the whites are considered Hispanics. I know when my father served in World War II, he was considered a white. I don't know if New Mexico just considers everybody who is non-African American or non-Asian, that everybody else is white. So I would like to see that stat. It's true, we all know that at least this part of New Mexico is at least 67, maybe 70% Hispanic, Latino, Mexican American, Chicano, whatever, but we're non-white. So I think that stat is very, very important insofar as assessing how different groups are being affected. You know, we have all those stats regarding, what is it, Minnesota, Michigan, I believe. Yes, Michigan and Louisiana, where there's a disproportionate number of African Americans who have been affected by COVID. So that's, and then the other big concern is this whole thing about testing. A lot of people, what's coming up now too, what's developed these past few days is that we're finding that, or we're being told. What do I find? I'm not a scientist. I'm not doing the research. But what we're told via media is that there are a lot of people who are asymptomatic. There are people who are tested because the spouse has been tested and comes out positive, and yet that spouse is completely asymptomatic, and it turns out that person is also a COVID victim. So we're not getting the testing, we're not getting enough testing and the results for people who do have symptoms. So what are we doing about expanding this to, it seems to me almost as if, it seems like everybody would have to be tested, because some of these people who tested positive said that the only symptoms they had was a slight headache, maybe a backache, and lost a sense of smell or taste So, so all of this goes to how is it that they can come up with models without having all these factors lined up. And then there were a couple of doctors who came out and said, reported on CNN that that this pandemic can last through 2022. So, there's just so many factors that I would love to believe that by mid-May we have peaked here in New Mexico. I don't think that's going to be true for the rest of the world. And I don't know how we will proceed, how we can proceed accordingly insofar as our economic development, our economic losses, the adverse effect it's had. So, as I said, these are questions, these are comments, these are concerns, but I think there's just a lot of phenomena that just hasn't been taken into account, or that haven't been taken into account on any, and also someone who has, quote, recovered, unquote, from this COVID-19. There isn't, I don't believe there's any testing after the person is symptom-free. And then the powers that be out there, Dr. Burke and Dr. Fauci and all those people, Dr. Burks, are saying that, that yes, you can have a relapse, that you really don't have that. So then now I think that the scientists or whatever, the powers that be, are probably are saying now that perhaps there won't be a vaccination or something that you can take, that will prevent catching COVID-19. So I rambled on somewhat. It's kind of a sort of a, any of you address those concerns that I've expressed, or those questions, or those doubts about testing and models, the predictions? Thank you.
Yes, thanks. Just to go through a couple of these, contact tracing. We're doing a lot of contact tracing in the state. We have, we're approaching, we have about 1,500 cases, and we are, we're doing contact investigations and tracing, and then contact monitoring of around all those. And a number of states have stopped doing that. After they hit a certain number of cases, they stop. We've continued doing that. And we have several teams, a couple associated with the Department of Health, one based at UNM, where, we've, talked about maybe exploring one down south, a team down south, because we do need to ramp up contact tracing. And the governor's announced that New Mexico is going to be part of a group of states that are going to be trying out, additional expanded contact tracing, along with additional testing, early testing, in a coupled strategy. And I think that's going to be really positive for us. Race ethnicity data. I'm looking at the Department of Health website. You guys may or may not know we have a new dashboard that's up, and you can go to it by doing Coronavirus New Mexico. Click on the new dashboard, and I'm looking at on the dashboard, and you guys can access that too. 37% of our cases are American Indian, leading us to the rate ratio American Indians compared to other races is about 6 times higher. The rate for American Indians is about 6 times higher than that for other New Mexicans. And then you mentioned about the Hispanic population. So the Hispanic Latino population, and this is the Hispanic Latino population in New Mexico, has about 24.5% of the cases, while that population has about 50% of the population in the state. So the rate for the Hispanic population is lower than that than that would be for the state as a whole. So that data is available on the Department of Health website, and that's updated daily. And you can also click on Doñana County and see some data for Doñana County, age breakdown, sex breakdown of cases for Doñana County. So if you haven't been able to go there, you may want to check that out. Regarding testing, I will say that I think New Mexico is really doing a very good job with aggressive testing. We are ranked the 8th highest testing rate based on some recent data I'm looking at right now. All the other states ahead of us, 8th among states: New York, Louisiana, Rhode Island, Massachusetts, Vermont, Washington, New Jersey. All the states ranked ahead of us are ahead of us in the pandemic. They've experienced earlier cases, they're going to peak earlier, and all that. So we're doing, I think, relative to other states, we're doing relatively well. The governor clearly wants us to keep doing better, and there's a lot of focus on increasing testing capacity. If you look at the positive test rate, so the more testing you do, the lower the percentage positive rate will be. So New Mexico is currently at 4.3%. We are the 5th lowest in terms of positivity, which suggests we're doing a lot of testing. Because as you test more and more, and we do have an option for, we do encourage cases, we do encourage contacts of cases to be, and specifically household contacts, to be tested. We're doing asymptomatic testing in nursing homes and other congregate settings, such as shelter populations and that sort of thing. So there's a lot of testing available. In terms of the peak, this is unpredictable in terms of the course of this pandemic. New virus. Do we end up with it becoming a seasonal virus like influenza? We don't know yet. There's speculation that will happen. I'm personally, and I think many people, and if you've heard Dr. Fauci, we're counting on a vaccine within 12 to 18 months. And more recently, Dr. Fauci has said, maybe even closer to 12 months. That's great. And that's gonna help us out. And that is in 12 months from now is in 2021. So there are lots of people speculating, lots of opportunities for people to speculate and make predictions. But we should count on a vaccine. We should count on a vaccine next year. And once we get the vaccine deployed, it'll be a game changer for what we're doing. Before that happens, though, an aggressive approach to testing and contact tracing, which the governor has advocated and is working with the White House to get additional resources for, is what we need to put in place.
So, Mr. Landon, or is it Dr. Landon?
Yes.
Yes, what, doctor or Mr.?
Doctor.
Okay, doctor. Thank you. So, as far as the testing goes, so if I'm having a symptom of not being able to taste or smell, and I've had a headache, and I've been very lethargic, do I go and will I be tested? That's hypothetical, by the way. But if I have all those symptoms and I go, will I be tested? I mean, I don't have a fever.
We're recommending testing for persons that have typical symptoms of COVID, cough, fever, shortness of breath, and for persons that are that can be asymptomatic if they're contacts of cases, if they're in congregate settings such as nursing homes, shelters, and the like. That being said, many people are getting tested in other categories without classic COVID symptoms. And so the recommendation that we've put out is just what I said, but at the same time, there are a number of people getting tested that don't meet those criteria. And I'm not advocating that, but that's reality. And we'll get a sense with the community survey that CDC is doing for Las Cruces, looking at basically testing anybody in the household to get a sense of positivity rates in Las Cruces community. We'll have a good sense of what the community infection rate is from that.
So, Dr. Landon, did I just hear you say that people who are asymptomatic are being tested, but just within the family household, or is that for anybody?
So
terms that
the CDC the assessment that CDC is doing right now is a community-based survey, and we're trying to get a sense of the percentage of people with symptoms, and then for that entire group, for the community-based survey, we're going to test as many of those people in those households as possible, regardless of symptoms, to get a sense of what the percentage, the infection rate is in a community such as Las Cruces with relatively low rates of infection. So that's going on. That's going on. That's being set up as we speak.
So as far as the vaccine is concerned, yes, Dr. Fauci and others have said that there could be, it's qualified, could be a vaccine in 12 to 18 months. But if you don't have immunity, because people can relapse. They're finding people who the doctors or the powers that be believe that the person is cured and the person in fact quote relapses, which means that the body hasn't built up the immunity. So that means that the blood that is being drawn from volunteers right now to see if their plasma can be used as a basis for the vaccine, and when there's that possibility of relapse, how possible is it to take the vaccine?
Well, I think I would not view the vaccine as speculation. I would view it as something that is very likely to happen. There's no reason to believe it won't happen next year. And there's a lot of effort going to creating vaccines, a lot of smart people working on that. COVID is the sort of #1 issue in society today. There's a lot of focus on it. I expect a vaccine within 12 to 18 months. In terms of relapse, there are lots of reports of different things. Are you just seeing, is it a reinfection, or is it just somebody who gets sick again with the same disease? So the studies are in process, but there is an expectation, even though we don't have the hard evidence to back it up completely, that there is immunity from COVID infection, and that's what we expect. And there'll be further studies that will, make that clearer. But the vaccine, I don't think we should be doubting that a vaccine is on its way, because a vaccine, we're going to be going to human trials here pretty soon, and there should be no reason to believe that we won't have a vaccine next year.
Thank you very much, Dr. Landon.
Thank you, Councillor. We have Councillor Bencomo and then Mayor Pro Tem Gondara.
Thank you so much to everyone that's presented. Dr. Landon, I really appreciate your you being on here and taking the time to talk to us, but I have several questions, so I'm just going to jump in. I think that Councillor Vasquez sort of had asked this as well, but I think I want to just re-ask and then echo some of those things, because it'll be important to get this information out to the public. But I would like to hear definitely from our medical experts. I think given the low numbers that we're seeing in Doña Ana County and in our community, and that our surge and our peak will be much later, I think the instinct for some will be, well, great, let's just reopen, right? If we're doing so well, maybe we can just get back to business as usual. And so I think it's important for us to hear from our public health experts about what the recommendation actually for that would be for policymakers.
Yeah, I would just say that it's not time to reopen. It's not really. The governor, I think, has stated it very well. We have to. This is a major public health issue for our society, for New Mexico, and throughout New Mexico, it's a statewide issue. The interventions that have been put in place are working, and we actually want them to work better. We want social distancing to decrease further. So we, as a population, as a community, or multiple communities, we can do better with that, and we can reduce infection rates more by doing that. So it's premature to talk about reopening. We haven't even peaked yet.
Thank you. Thank you so much for stating that once again. I really appreciate it. I understand the instinct to want to say, let's just get back to normal. And I think, I think I also deeply, deeply understand that it's just the wrong decision at this time. Given what just happened at the Supreme Court this week, will the Department of Health be putting out recommendations for municipalities as we begin to prepare for our June primary?
That's being discussed right now, and there should be recommendations coming out. I would expect them to be coming out of the governor's office and from the governor. I would, every expectation that there will be recommendations coming out.
Right. Is the Department of Health continuing to give and to provide testing supplies for testing clinics down here, as well as PPE?
Don, do you want to take a stab at that one from the regional perspective?
Sure, Dr. Landon. So for public health proper, we continue to do testing. Well, we continue to do testing here at our Las Cruces office Monday through Friday. As far as PPE testing kits, yes, other community partners are able to order those supplies through the DOC. So through the state, they are provided that equipment, and that the requests for that again go through the Office of Emergency Manager. There's a certain form, a 213 form, that is shared in order to request the PPE.
Through the OEM, is that what you said? I'm sorry, I missed that.
Yes, I'm sorry, Councilor Bencomo, through the Office of Emergency Management.
Great, okay. Do you, maybe, I don't know if this is a question for you, Ms. Santos or David, but has the OEM been requesting these resources from the state as we prepare for the surge?
Yes, I mean, absolutely. I think, again, it's a process. The requests go to the doc at the state level. And again, the doc is responsible to look at supplies for the entire state. So we do send in requests. Even for us, we kind of try and send a request in for probably the next 2 weeks at least, so we have enough to cover. But there is, I know, and Dr. Lyon, you might be able to speak about it too. The governor is able to access the national stockpile to get other resources into the state that then can be shared around to those that need it throughout the state. So it's a statewide process for sure.
Great. Yeah, I mean, I think given that, our surge and our peak is likely later, mid-May, perhaps, that I think it gives us a good time to prepare, right? To be prepared and to ensure that we have the resources that we need. Maybe in that way, it's a positive thing for sure. The last things I'll say are mostly about data. And the reason I've been asking for data that includes demographics and zip codes, it's not just for me or us to understand the virus. It's really about understanding who is being impacted. I think people keep saying that this virus doesn't discriminate, which is true. What does discriminate is our government entities. What does discriminate are government responses and public health data often, which then allows for inequities to continue to grow as we plan a response for the crisis, but even for the aftermath, right? How do we ensure that the hardest hit communities recover just as fast, economically, physically, mentally, spiritually? And, as we think about a vaccine, how do we make sure with this data, right, we'll be able to say, these are the communities that should be allowed access to the vaccine first, which in New Mexico, clearly that should be our Native American communities. But I think that this is why I've been asking for this data. I think it's really important to understand that our low-income communities are being impacted heavily and at the hardest. It's important to understand who is being hit the hardest so that then we can deploy resources equitably, and that those who are hurting the most are getting the most help. So I appreciate everybody's willingness to seek out that data. I was also disappointed to see that in the data we received just this week. I was really excited we got the data this week by breakdown demographic, but I was excited to see the erasure of Latinos in that data. But I'm glad to hear Dr. Landon say that we can find that in the Department of Health. So I'll just say that there wasn't really necessarily a question, but if anybody wants to respond to that, I would love to hear your thoughts as medical professionals. But if not, that's it from me. Thank you.
Thank you. We have Mayor Pro Tem Gondara, Councilor Sorg, and then Councilor Bate-Stugi. Mayor Pro Tem.
Thank you, Mayor. Thank you to Dr. Landon, Don Sanchez, and David Morgan. I appreciate it. I know how busy you are. Dr. Landon, I have the utmost respect for you. We've worked a long time side by side at the Department of Health many years ago, and so I have been sort of touting basically what my experience is, and what I do know Department of Health does and does very well is this idea of tracing and infectious disease, and really trying to break the cycle, if you will. I think that's super, super important. So I appreciate you being on the line. And my questions are around who dictates, or in terms of the number of testing that gets assigned to our community.
The approach is set up, through Department of Health and the governor's office, and there's a lot of focus, sort of a twofold focus. One is on hotspots. So in areas like in places like nursing homes, detention centers, jails, homeless population, in those sorts of settings, where are people becoming symptomatic? Where are there cases amongst staff or the residents? So there's a lot of focus on that, and there's a lot of, it's like real time, something that happens in the, we do a case investigation at 10 p.m. at night. At 6:45, at the 6:45 meeting, folks are deployed to go test at that particular place that we just noticed a case. So there's a lot of responsiveness to where cases are popping up. At the same time, it's acknowledged that where we test, we'll see more cases, and therefore we need to make sure we have a representative testing strategy throughout the state. So with the rapid test deployment, deploying the rapid testing Abbott machines, those were pretty much deployed throughout the non-Albuquerque metro area, and as I mentioned, I believe that Mountain View and Memorial both got those machines. So testing decisions are made on two levels. One, where are we seeing the cases? Let's test more to reduce spread around those cases. And then let's get a representative idea of where, throughout the state, of where cases that may have been undetected are. And the nursing home approach that is being geared up, that we talked about a little bit before, where we are going into a systematic approach to most nursing homes in the state, and many of whom don't have any indication of cases, don't have any staff that have had COVID. I think that's a really good proactive approach. So we have sort of both the react to cases and the proactive approach that is being that's in place.
Thank you for that. You mentioned, and I've been asked several times, if testing has been conducted at the detention center. Do we know that to be accurate? Either Dr. Landon or Dawn?
Dawn, do you know about the detention center in Las Cruces, whether there's testing that's occurred there?
Dr. Landon and Councilor Gondra, Mayor Pro Tem Gondra, I'm sorry, I do not know if there's testing occurring there. I do know that they have been working to get their own supplies though too, through the same process with the doc, to be able to order their own test kits and supplies to be able to test as needed there at the detention center. But I don't have, I can definitely get you some more information on that though.
That would be great. And I'm wondering if staff could reach out to make sure that our citizenry there is being tested. I think I would hate for there to be an outbreak and us not be proactive enough at this point, especially when Dr. Landon has indicated those are sort of the places where we should be checking. The other thing is, and I've asked, and I'm hoping that there is some follow through, is with Colin, is ensuring that our shelters like Community of Hope, Gospel Rescue Mission, our teen shelter, our youth shelter. I know that, Dawn, thank you so much for entertaining the call or the texting back and forth between you and I and Families and Youth Incorporated Clinical Director. I know one of the concerns that they have, that they're accepting youth, right, that are coming from all over the state. And there's been some concern about some of the youth and staff being exposed and having the symptoms. And so I just want to make sure that we, in our areas, that there's access and that there's special attention being made to these particular special groups. And I'm not sure that that's the case. And so I feel like it requires conversations. I know that I've been seeing notes from OEM that it feels like at least Community of Hope, CYFD, are a part of some of these conversations, but I, again, am asking for people to reach out to Families and Youth Incorporated and all our other nonprofits, our daycare centers that are still currently caring for children, specifically children of our first responders and or our medical community. I think is so important because they are probably because of the parents, right? And I'm not sure what arrangements have been made that they could be exposed. I'm looking through my notes. Sorry, let me. I appreciate my colleagues. Specifically, I've been receiving several emails from small businesses. I'm very concerned about, closing and specifically places like that sell sort of like equipment, physical fitness equipment and whatnot, feeling like they could be looked at as essential. I'm starting to feel like there is huge, as we talk about discrepancies and or is like from the big box to the smaller businesses. Like, for example, why is Walmart and places of that sort still open, still selling clothing, still selling items that maybe are not deemed essential. And so, Dr. Landon, do you know if there's conversations being had about sort of looking into very carefully and being safe small businesses that might be able to be opened up, such as the ones that I've made mention?
Mayor Pro Tem, I'm not privy to those sorts of discussions, but I would imagine that those are going on, but I don't know for sure.
Okay.
Mayor Pro Tem, I can just jump in real quick. So every Thursday, group of mayors, about 40 or 50 of us around the state, have discussions. And so what you've just pointed out, and Councilor Vasquez have pointed out, is there's going to be a few of them. We're going to be trying to talk with the governor to see about if there's a few select that could slowly open, and if certain restrictions are put in place, like requiring all the employees to have masks and gloves and maybe even take temperatures of customers who might be coming in. So those discussions are happening or going to happen. They're trying to get a meeting with the governor, and I'll keep you guys, keep the council apprised of what takes place.
Thank you, Mayor. And lastly, I have, being a social worker, I've been concerned with mental health and COVID, social isolation. I've appreciated the work and the collaborative efforts that are being made and done with the various departments. But as you know, social distancing is one of those things that also leads to the isolation. You made mention of substance abuse, and I know that some of those things are clearly at play in the northern part of the state. But I wanna just put a plug in, and Dr. Landon, if you are seeing any specific issues as it relates to substance abuse, mental health, and COVID, particularly in our area, and what we might do to help deflect that and or assist as a municipality, encouraging folks to seek help. We've done some things already. Each one of the counselors have done 30-second segments as it relates to child abuse, our water supply, if you're experiencing a crisis, the crises line, and all those resources are being put up on our website and our Channel 20. but are there any other things that you think we should be thinking about moving forward?
Mayor Pro Tem, yeah, I think that's an excellent point. The most vulnerable people in society are also most vulnerable to COVID, and I think that point has been made by a number of people today. We really have to think about the whole person in this as we're dealing with COVID, and I think the state of New Mexico has really, and also communities such as yours, have really done a good job thinking beyond just the infection, and that's critical. We're hoping to have some data relatively soon on an ongoing telephone survey that we do, as we've done it for 25 years of adults in New Mexico, and we have some specific additional COVID questions in there, but then we have the basic questions. How is your have you been drinking lately, smoking? Have you been sad? How many days of the month is your mental health not good? All those things. And so hopefully we'll have some at least preliminary data available. And perhaps for communities as large as Las Cruces or Doña County, we may be able to have some of that. But for what you all, I mean, I think just having this forum, allowing people to think of these issues, and also think of ways that people can get connections to others while they're being socially isolated, particularly people with mental illness and substance use disorders. Telemedicine, video conferencing, that sort of thing may or may not be the ideal strategy for some of these people, but just, how can we connect to people better who might be isolated and at greater risk of complications from this disease?
Yeah, I appreciate that. One of the things that I've been pushing, and you mentioned social determinants of health, and just with your comment with telehealth and our broadband and or the digital divide, this doesn't work even for folks within our urban community. And so I'm deeply concerned that we're asking folks to sort of move into doing things remotely, telehealth when people don't have access to computers and internet. And so I'd really love for, I guess this is more directed to staff, for us to start looking at possibly deploying hotspots, looking at these community members that, because if we can keep our community healthy, that means getting them to, as Councilor Vasquez indicated, some of these physicals, these check-ins that are being done via diabetes and such, then we're better for it as a community. But if they don't have access to these very, in my mind, basic services or basic tools, then we've done a disservice. And so I don't know how we move to that. And I'm sure there's data out there that would support where these hotspots, and I'll call them that don't have the kind of and we could probably work with the schools as they've moved into doing business online. They are well aware of families that are struggling. So it's one thing to offer free internet for a couple of months, but it's another to really understand that some of these families don't have a laptop, a computer. And so I feel very strongly if we're going to get information out. And then I also am concerned about a lot of our stuff being put on our Channel 20 when a lot of folks don't have Channel 20 as well. So we moved into radio spots and our Facebook and those things. Again, you have to have the electronics to be able to access that. So I'm hoping that staff could do some research, looking at data, reaching out to our schools to see if the deployment of hotspots might be a way, and or maybe considering opening up our library as a space for folks to get information, which I know is exposing our folks more than we want that to happen. And so I feel really strongly about this. I also want to say that I've been talking about online platforms such as mental health screenings for depression and anxiety and other mental health issues that I think is going to be really important. I feel like we need to do this sooner than later and would really love to see that being placed on our website as an avenue for people to assess and then be able to find the resources. I just had a meeting yesterday with several nonprofits and folks that are very interested in working with me or with us to ensure that that takes place. So there's some very innovative discussions and things that are happening, particularly from FYI, the Peak, MMC, Mountain View, and others that are offering those kinds of things. But I'd love to see an online platform of assessments being offered to our constituency. And so I'm hoping that staff could, David, I know we've been talking about this a little bit, but I really am deeply concerned and until we figure out, where people are at so that we can deploy those resources, I think we need to, again, do that sooner than later. So thank you, Mayor.
Yes, Mayor Pro Tem. Let me just ask a quick question of Jennifer, our city attorney. Jennifer, let me ask you this. If the city was to set aside some money for telemedicine, let's say we contract out with 10 doctors or so at say $7,500 a piece, can they have like a call in so that members of the community who need that assistance or someone to talk to, a medical doctor, whether they may think they may have COVID-19 or they may have some other issues, is that something that would be allowed, do you think, or would we need some time to research that? Or is Jennifer there?
Jennifer is there, but we can't hear you, Jennifer.
Yeah, we can't. Okay, well, we'll come back to that whenever she has a chance. So we'll go ahead and go to Councillor Sword and then Councillor Abeyta-Stube.
Okay, thank you, Mayor. My question, it actually is kind of a repeat. Apologize for that. I think the mayor and by way of the Mayor Pro Tem touched upon this, but I want to get an answer that is confirming the planning for the future concerning the COVID-19 and involving more testing in the state, processes and how businesses will open, and not necessarily a timeline, but maybe a timeline, but especially testing employees that might have access to the public, things of that nature. Is the state making plans for that right now? Just a yes or no answer would be fine.
In terms of testing, yes, lots of focus on testing.
Okay, and then plans for how we might open up the economy some?
The governor has, I think, spoke to that just yesterday, and
yeah, she doesn't. She's now. I think I'm talking about the future.
Right. I mean, we're focused on getting to the peak with reducing illness and death at this point. That's our major focus right now. But I think the governor has spoken to, at least thinking about beyond the peak.
Okay, good.
Councilor,
last question.
David Morgan. I'm sorry, sir. Could you hear me?
David?
Yes, my apologies. I'm sorry to interrupt you.
Oh, that's right.
Councilor, the governor has definitely spoken to this. She and even the Department of Health understand the tremendous economic hardship that our community and our state are experiencing. It's the only thing truly that is going to be able to dictate our ability to be able to begin to reopen our state is going to be those case numbers. If we can those down, if we can sustain keeping them down, and we can have some reliability that we are not going to get out of state cases flying back into New Mexico to again spike spread. That is going to be the true factor in this. Everybody wants to be able to reopen the state, country.
Okay, does this plan involve any testing for the novel coronavirus antibodies?
There is discussion of that both nationally and at state level. So that's under consideration about the best approach. There are just many different approaches to it. The test is new. The worst thing you can do is give people basically false information from test results. So we've got to get the test right, and there's exploration of the best test for antibody testing right now.
Okay, you're thinking about it though. That's what I was asking.
Yes.
Okay, good. Thank you very much, and thank you, Mr. Mayor.
Thank you. And before I get to Councilor Beta-Stubbe, so Jennifer just texted me that she's having trouble with her audio, but that she'll go ahead and research that issue regarding whether or not we might be able to hire doctors for telemedicine. So, okay, Councilor Beta-Stubbe.
Thank you, Mayor. And thank you, Dr. Landon. I have a couple follow-up questions regarding that, the rapid testing that you said was now going to be available in Las Cruces. Are there any special considerations for one to receive a rapid test? Do they need to be adhere to certain levels, the symptomatic, or is it the same guidelines are used for those tests as just the regular tests that are sent up to Santa Fe?
The rapid APID test infrastructure that was sent out to many hospitals throughout the state is largely being left up to the particular hospital to make those decisions. Our assumption is that they'll follow the state guidelines, but it's not really being restricted, and they can use it using their medical judgment to do appropriate testing.
Okay, and about how many of those tests are now currently available in Las Cruces?
Yeah, I don't have that number. I'm not sure. I'm not sure how many of those are available at this time.
And Dr. Landon,
I don't know if Don or David, if you all know that.
Currently right now, we do not have the Abbott rapid test here in Las Cruces at MMC or Mountain View. They do have it at Gerald Champion. So from my understanding from our epidemiology nurse, that both MMC and Mountain View are taking their test that they're collecting here to Alamogordo every day to get that rapid test done on them. Okay.
Is there plans to have our major hospitals be able to have those capabilities here in town?
And Councilor Stubbe, I'm sorry, and Dr. Landon, I'm not sure if you know that. I don't know how they determined. I knew that they were sending out those rapid tests to the more rural hospitals, but I don't know how that was all determined or if there's going to be more coming. Dr. Landon, do you know?
Yeah, I mean, we need to get our message straight here. I was under the impression that I'm looking for this list.
And Dave Morgan, I apologize for hitting *6 slowly. The answer is we want to be able to get that testing available for Las Cruces as well. We only did get a handful of those test kits, and as Don reported, the emphasis was getting those out to more rural counties at this time. As we get more tests, the more you're going to see hospitals being able to have those in hand.
So for clarification's sake, we do not have rapid testing here in Las Cruces then?
That is my understanding right now, yes. But I will also be happy to confirm with both hospitals for you.
Okay. And then there is hopefully then plans that we will be having those rapid tests here for Las Cruces.
There is every intent, absolutely.
Okay, and what is our current time now to receive for a hospital when they give out a test? What's the current time that it's taking them to get back either a positive or a negative confirmation?
I wouldn't be able to speak for the hospitals specifically. As some of them may actually do outsourced testing still at this point. But any testing that is done certainly by the Department of Health is sent to our scientific laboratories in Albuquerque. The other lab currently testing in New Mexico is TRICOR. Between the two of us, we have an excellent daily testing capacity that continues to grow by the week. And our turnaround time collectively is within 24 to 72 hours. And that depends on several factors, not least of which is the travel time to be able to get the test samples to the lab. And also priority is absolutely given to COVID positive cases to be able to reach out for test results.
Okay, thank you. That's good to hear. I think my main concern with this, and I think I keep posing this question as, the second largest city here, if we do experience a high peak, it's going to be so important that we have that rapid testing available and that we're able to really make sure how best to treat patients. If we have 72 hours to wait for a positive result, and we're accepting patients from rural communities, and we know that we're a larger community ourselves, I can see how that process could get very slowed down. And I don't think that's very wise of us as a city. We need to be able to have that rapid testing, and we need to make sure that we have a very good plan in place for that. I hope that we're able to have a facility if TRICOR is able to test here in Las Cruces, but I just think it is so important that we have testing capability here in town, that we do not have to keep sending things up to Albuquerque. I think that's going to be very important, and it seems like perhaps we have enough time to figure out how to plan best, and if it's something that the city needs to help with, I just want to make sure that we are planning as best as possible before that peak and that surge. So thank you.
Yeah, I would add, excuse me, David, that the Las Cruces is on the distribution list, and which we received both Memorial and Mountain View. That, I think what we're hearing from Dawn is that maybe that test is not deployed at this moment, but those two hospitals are on the distribution list. And perhaps, David, you can provide people with an update after we get this cleared up a little bit.
Thank you.
Yeah, absolutely. Counselor, your concerns are absolutely justified. I'll make it my job to figure out if both of our hospitals have those test kits in hand currently, and if not, when they will.
Thank you. And I'd like to add, and I hope that's for not just the rapid response, but just the regular testing too. I see no reason why a place our size should not have the capability to test in our own city and to have those results. And I think that when the surge hits, when all of these different entities are going to kind of be bombarded with items, we need to be able to handle our cases in our city. We need to be able to test all tests in Las Cruces. So I very much look forward to seeing how we can work with that and how we can best help to make that happen.
Understandable. It is going to be really dependent on the technology actually available within our community, the ability of even having test capacity. I personally don't know what that is for Las Cruces and Doña Ana County, but we will collectively find out together.
Thank you. I think that'd be great. Find out what we need to make that happen. It looks like if our surge isn't and our peak isn't expected till towards May, I think that we all can look to see what best resources that we can bring here. So thank you, and thank you, Mayor.
Thank you, Councilor. Mayor Pro Tem, you have a comment?
Yeah, yes, Mayor, it's to this point. Thank you, Councilor Vetasube. I appreciate you powering through this and making it very clear that the second largest county in the state should have that capability, not only for testing, regular testing and rapid testing, but also for the laboratory. We have a TriCore here. Again, David Morgan, Mr. Morgan, I'm not sure, again, like you said, what our technology is or our capability, but we should have capability. And to Councilor Abeta-Stubbe's point, El Paso is just down the street. So if we can, and many of our people go and seek services there, labs, hospitals, those kinds of things, I'm hoping that we could not only have the testing, but the labs, the results, so that it stays here locally and we ensure that our people are getting rapid response. And I know now that Dr. Landon and David, I have, again, the utmost respect and confidence that you will do all that you can to ensure that our county is taken care of. Thank you, Mayor.
Mm-hmm. Thank you. Councilor Bencomo?
Mr. Mayor, thank you. Just want to say one quick last comment because it's something that Dr. O'Handon said that really stuck with me and I feel like I can't shake it off. But in response to a question about when, reopening our economy, Dr. Landon said right now our focus is on reducing sickness and death. And that was really powerful and heartbreaking. And so I just want to thank you for your focus and clarity, but also your commitment to our community. So thank you.
Thank you very much.
Councilor Vasquez?
Thank you, Mayor. Short comment from me. I just want to thank Councilor Abeta-Stubbe for the wonderful questions she asked today, but also for making sure that we get the resources that we need, as well as the folks on the phone from the Department of Health for your patience and understanding in this whole process. But we do need the resources that should equitably be distributed to us, and so. Oftentimes there's a kind of a disconnect south of Socorro, especially when it comes to the centralized kind of operations that happen between Albuquerque and Santa Fe. So I just want to thank Councilor Abeta-Stubbe and everybody on the phone today for taking the time to be with us and for making sure that our folks down here get what they need to keep their community safe. Thank you.
Thank you, David. Maestas?
Yes, Mayor, thank you very much for turning it back to me. I appreciate that. This is for David Morgan. Mr. Morgan, we talked about the zip code information. You also mentioned the Sandia information, their projections and data that they put together. To make things easier, if you could just send them directly to me, and then we do one of two things. If it's information that I am allowed to pass on, we will put that on our city website, which we have done with the majority of information you have sent to us. For example, the dashboard that you talked about just now, council and anybody watching this, you can click onto the link that we have on the city's webpage for our COVID-19 updates. Anytime an update is sent to us, we put it on that link. The other thing that you can do, there is a button on there, another link that allows you to receive notifications. Rather than you having to go to that website over and over again, if you click on that link, anytime a new update is put in place, it will automatically be sent to you so that you're aware of new information that comes through. So, Mr. Morgan, if you can get me those items, I would greatly appreciate that. Send them all directly to me and we'll make sure that we get them disseminated accurately for people to be aware so that they understand the situation, but also to help us as we're making informed decisions. And then, sorry, go ahead, sir.
I was just agreeing with you. Absolutely. We will get that information to you.
Okay, very good. And then an additional request, we have posed it before in many different situations through OEM, through emails that have sent directly to Department of Health. But one of the things that we would really like assistance with, and I know this is something that may not be able to be public, but if we could get a little bit more specific on identifications for positive cases for our first responders. One of the biggest concerns that we have, and I'm sure you've heard this throughout the state, is that as a first responder is heading to a household, we want to know for sure if there is a potential for a positive case there so that they are adequately addressed. Staff has their correct PPEs in place, their personal protective equipment. We don't want to expose or jeopardize our first responders in cases where we know that we can have additional protections. Granted, I know that is probably not something that would be sent out to everybody, but if there is a way we can work on a system through our first responders networks, that we can get some kind of information to make them safer as well when they're responding to incidents. That we can talk about more offline as need be, Mr. Morgan, but we would appreciate anything that can be done with that respect.
Yes, sir. And these the folks with us here on this call are exactly the people that we'll be working with on that.
Excellent. Thank you for that. I appreciate it. That is all that I had, Mayor. Thank you.
Okay, thanks, David. Well, I just want to take a quick moment to thank you, Dr. Landon and Dave Morgan and Don Sanchez for all your assistance and sharing with us all this information. You know, I know it's very tough what you all are doing, and we appreciate your support and information and sharing with us here this morning. So if there's nothing further, I believe it's appropriate to get a motion, a second to adjourn.
Mayor, if you don't mind, we did have a presentation. I know staff.
I'm sorry.
They put some work into it. They could easily say we can move on.
No. I didn't see that. It just said had information gathering dissemination. Sure, go ahead.
The presentation that staff has put together is about the dissemination part. I kind of touched on it lightly on how we get the information out, but I know council has been concerned about what information comes to us and what has been sent out, as well as public, so that they are aware of how they can receive as much information as possible. So if it's okay with you, I will turn it over to Mr. Udell Vigil, and he will start off the presentation.
Gotcha. Thanks.
You bet.
Sorry, Udell.
One moment. We're going to get on board. Got disconnected. Oh, there you go. You're on.
There you go. Councilor Sword? There you go.
Yes, this is Mr. Mayor. I have just a quick.
What? No, I was thought you were gonna chime in with your F5.
Oh no, I have just a quick question. I'd like to ask the council when they're done with the presentation.
Okay. Sure. Can't hear you, Adrian.
Are we good?
Yeah, I can hear you, Udell.
Okay, very good. Sorry about that, everyone, and good morning. And thank you again. As David said, Jamie Rickman and I are going to kind of do a dual presentation on the public outreach both of our offices have been doing since the start of this situation back around March 11th and 12th. So I'm going to start off with the Communications Office Outreach, which is a multimedia bilingual campaign. And one of the things that the council has been commenting about recently is to use more radio or to start using radio for our outreach. So I'm going to kick off with that. So we did media buys with both Bravo Mike Communications and the Adams Radio Group. I'll start off with Bravo Mike. Our total ad buy with them is a little over $3,000, which gets us 336 paid spots, 186 paid, 150 bonus for a total of 336. The schedule actually started on Tuesday of this week and will run through May 3rd. So the three of the stations that we bought on Bravo Mike are 101 Gold, which is classic hits, and the demographic group is 35 plus. You'll see as I go through these slides that we have a mix of demographics to hit as many people as possible in the community. What you'll notice on the schedule, 62 paid and 50 bonus, and the time periods underneath those are going to be the same for the following two stations, right? So we have 336 spots total. We divided them equally among the three stations. So that's 101 Gold Classic Hits. Next, we did the Spanish language station, which is 96.7, and their demographic group is 18 to 49, which is a little younger. And finally, with Bravo Mike, Magic 105, adult contemporary with the 25-54 age group. Moving on to Adams Radio, our total buy there was approximately $2,500, which gets us 278 spots, combination of paid and bonus spots. That schedule actually begins this Monday and will run through May 8th. So you'll see a little overlap and pushing it out from the May 3rd date with Bravo Mike to May 8th with Adams Radio. The stations we bought there are K-Great 104, which is a country music format, 18 to 54 demographic. We have 98 spots total on that station. And the schedule is Monday through Friday, 6A to 7P, and the bonus spots run Monday through Thursday, 6A to midnight. We also did Hot 103, which it's an English language station, but they're also agreeing to run the Spanish spots for us. And their demo is 18 to 34. That schedule is Monday through Thursday, 6A to 7P, and then the bonus spots are Monday through Sunday, 6 a.m. to midnight. So we have the Spanish station on the Bravo Mike side. We have Spanish running on Adams Radio on Hot 103. And they're also running the Spanish spots on Classic 98.7, which is a 35 to 64 demo. The schedule is pretty much the same, and we have 30 total spots on that station. And lastly, it's Cool Oldies, which is the demographic of 55 plus. We have a total of 100 spots running there, 50 paid, 50 bonus. And that schedule is Monday through Friday, 6 a.m. to 7 p.m. And then the bonus spots are running Monday through Friday, 5 a.m. to 8 p.m. In terms of the video side, we actually started our outreach on March 5th. David Morgan referenced this in his presentation when we did that live COVID-19 forum in city council chambers, which we televised and streamed live. That was with Dr. Michael Landon and another gentleman with NMDOH along with David. Following that, we did a message, a 30-second message with Mayor Miyagishima addressing the community once the outbreak had really taken hold in our state. And that was followed by, on March 14th, we dedicated our cable TV channel, Comcast Channel 20, exclusively to COVID-19 information. And that's running 24/7, and it's continually updated. Then on April 1st, we co-produced with the Joint Information Center and our partners in the county a video with the mayor, the county manager, the school superintendent, and David Morgan from NMDOH. All right, so we launched a video campaign involving all 7 mayors of council, and this was done both in English and Spanish for a total of 14 spots. So what you see before you are the councilors and the topics they address. So the mayor addressed adhering to the emergency order, and Councilor Bencomo did the Spanish version of that. Mayor Pro Tem Gandara was addressing child abuse and prevention. She did both English and Spanish. Councilor Abeta Stuvey took on the topic of mental illness awareness, and Councilor Vasquez did the Spanish version. Councilor Vasquez addressed the city council emergency action similar to what you did earlier this morning, and he did both, as did Councilor Bencomo. She did both of hers as well. Councilor Sword talked about the high quality of our tap water, and Councilor Vasquez did the Spanish version for him. And Councilor Flores talked about basically patience and kindness. Let's be nice to each other in this difficult time. And she recorded both English and Spanish as well. Along with the video campaign, we posted a hot topic, and I know council's interested in doing as much English to Spanish as possible. So if you look on the left side of the screen, this is the actual hot topic badge, if you will, that appears on the homepage of the website. So the message itself is in English and Spanish. And when you click on the link, it'll take you to the page similar to the one that you see here, but it's in English and Spanish as well. So that is what people will see when they go to the homepage of the website. Now, these videos that we did with you all, council, are already appearing on Facebook, Instagram, Twitter, CLC TV, that's the cable channel, YouTube, and the city website. And we're investing $2,000 in the social media campaign. We started rolling out those videos on April 11th, and the last one just went out today, and that campaign is going to run through April 25th. The videos that were recorded in English are closed captioned in Spanish, and as I said, they've been posted one per day through today on the social media sites, along with YouTube and the city website. Videos that were recorded in Spanish that are appearing on Facebook and Instagram in a paid advertising campaign. So we're specifically targeting Spanish speakers on Facebook and Instagram with the Spanish language videos. On CLC TV, we've got that continuous information going. As I said, we dedicated that channel 24/7, but we're going to be airing those videos as well in a block segment once per hour. And as I said, I showed you just a minute ago, you're able to access those on the hot topic on the homepage of the website. I did contact Telemundo and Univision affiliates in El Paso and asked if they would consider running the Spanish version of those PSAs, and they did express an interest. So we're going to be providing them the links to those videos in hopes that they do push those out on their TV stations. Other outreach that the communications office has done, right away when it all started hitting back on March 11th, first thing we did was we put a hot topic on our homepage with websites to NMDOH, the governor's office, just trying to get some initial information out there. And then we followed up by establishing the COVID-19 Alert Center, which is the primary source of all this information on the website. Councilors Vasquez and Bencomo like the idea of doing a vanity URL for that page. So Councilor Vasquez actually made the choice of COVID-19loscruces.com. That went live on March 17th. So today you'll see the number of news releases and web posts that we've done, approximately 122, and this number is a few days old, so we pushed a little more out. So that number is a little higher, as are the number of Alert Center posts. We have at 171, and that's probably around 180 now. The Facebook page posts, we've done 79 that are COVID related, including streaming all of the governor's news conferences from Santa Fe. City manager Facebook page 76 posts, and the city manager report, which is goes out by email, 42. We're working with utilities to put an insert in the May billing, promoting more social distancing, because that seems to be one of the biggest issues that we're facing, or people adhering to that. So that message will be going out in May. Also, Las Cruces Utilities, as you know, initiated an alert system where they can actually push out messages to utility customers, approximately 24,000 each time. So they've done 3 so far. They did the park closures right before Easter. They did pushed out a message that they're going to discontinue shutoffs. And now they're in the process of pushing out the English and Spanish messages that you all, council, recorded and we're using as radio and TV spots. So that's it for the communication side in terms of outreach. And so now I'm going to turn it over to my colleague, Jamie Rickman, who is heading the Community Engagement Office.
Well, good afternoon, everybody. It's almost at noon. Thank you for allowing us to be able to present this information. What you see on the first slide here for Community Engagement Office are bus wraps that my office created for Quality of Life department. And that's one of the things that we've done, is being able to support these departments in their individual targeted messages to their clients. So this one is also in Spanish. I didn't have that version in time for this presentation. Next slide, please. So for an overview of the engagement since March 18th, you know, we were pushing out information about COVID-19 testing availability when it became first available. And we made calls to other departments to please push it out to their databases, which was really important, because not only do we have a lot of access and exposure with our traditional methods, but all of our databases that we've been gathering through meetings and just everything was very important to use as well. And so we put out also general COVID-19 public health messages. And then what do you do during public health order lockdown? It's for families and children, you know, it was got to be really full of tension there, because kids were at home and they didn't have anything to do to speak of. And so we were putting out, or helping to put out programming for kiddos. So the visual that you see here are going to be seat covers and posters for transit seats to help people, to guide people into knowing where the social distancing is appropriate on the bus. Next slide, please. And then again, this is just a real quick summary of what we've been up to, and it's continuing on. But we've had to do some readjustment of our workload because of COVID-19, and that primarily has affected the census outreach and engagement. We've had to cancel all in-person events and retool everything towards social media. And then we're also having to rethink, of course, and regroup on the general obligation bond public meetings. Those were really critical, but we figured out a way of, a hybrid way of providing the information to the public, garnering that input that we so meaningfully seek from people on the projects, and then being able to report that back in a transparent manner. And then both of those campaigns are helping to provide more information to us regarding the COVID-19 messaging and the approach to messaging as well, because as has been noted throughout this whole meeting is that there are folks who have great access to digital resources, but then there are folks who don't. So that's our biggest challenge, obviously, is to reach those folks who don't have that access. Next slide, please. So the focus of activities, as Udell had mentioned too, our support, my office's support with this is generating those news releases for the content. And so we've been generating that content for news releases that have wide distribution, used on the city website, used in social media as well. And then we've been pushing like crazy too the Notify Me subscriptions option, which is really important. Then there's the social media, Facebook and Instagram for the city, library, parks and recreation, transit. There are also other Facebook pages that aren't owned, quote unquote, owned by the city, like the Southern New Mexico Earth Day, but we we provide links and likes and keep grooming those messages on those external social media platforms, so we can keep that energy going and let people know that, hey, we're still active. These are the messages coming up, and this is how it pertains to your particular area of interest. Then on the city website, we've been updating content on individual pages with messaging. And on the website, as you well know, you can select your language of preference on there. And so that becomes bilingual depending on the readers and the users' preferences. And so a lot of those pages that we were updating include those that are listed there. Next slide, please. And these are the examples. So we have updates with Roadrunner Transit, senior programs, and more on senior programs, and then social media senior programs. This is just an example. Next slide, please. And then, as I mentioned earlier, the department databases were super important in this effort. And we have quality of life, parks and recreation, economic development, community development, public meetings. So that all results in about 10,000 direct email contacts, which is just phenomenal, I think. We contacted boards and commission members, which we asked them to distribute widely to their groups as well. So that was an initial contact of 130 people, and then who knows how much that translates into when they spread that out as well, kind of like the virus itself in some ways. Department support for message development, email notifications, news releases, signs at facilities, we assisted with that as well. And we enabled because of our systems, we were enabling directors and department staff to be able to focus on their operational aspects, knowing that their message being taken, their specific messaging was being taken care of. Next slide, please. So by the numbers, and I need to put a caveat on these numbers. So this is just a snapshot for you all. And what this means is that it doesn't account for one person who might be in various channels, who might be signed up for social media or the Notify Me subscription or any of these others. So it's just a snapshot. It just kind of helps give you an idea of the numbers involved. The staff was involved with helping with the story time, for example, with the library. And so those specific videos that were developed, story time, for example, had 1,600 views. Protocols, which means washing your hands and doing the right things and protecting yourself from COVID-19, that video had 1,400 views. Right now, my staff's working on a transit video, which is currently in production to help understand what that social distancing looks like on a vehicle. Databases, again, about 10,000 people reached, section department Facebook and Instagram followers, and this includes the cities as well. It's a reach of 16,654 people. City feedback, city Facebook and Instagram followers also 22,000. Sorry, that was separated out. 22,336. And then the city website subscribers who notify me is 1,464. Next slide, please. And then specific areas of focus, as you already well know, is transit with bus wraps, banners, seat markers, and video. Parks and recreation, you can exercise at home, contact and tips, and that's what the little visual there is, the graphic is there. That was one of the first ones that we put out there. And we kept putting out information weekly about the types of exercise that you can do at home and still stay healthy and that sort of thing. Kind of keeping people engaged throughout all of this. The library, museums, virtual story time, public health messages, senior programs with public health messages, volunteer network, the same. And then other departments helping pushing out that critical information that was available. That critical information also included the resources that they could find this information at as well, which included the city website. Next page, please. And then in looking at this retrospectively, once the smoke kind of clears, I mean, we're starting to collect all of this information. Now we need to sort it out and figure out how to use it better. We want to improve education to the community about the resources available. That's still a big issue, that people didn't know that information was available. Increase the repertoire of online programming and interaction. COVID-19 has forced us to think about this sooner rather than later. And then information gained from debriefing of the event, assessment and input from the community. I'm working on a plan now that kind of outlines how to go about doing that and capturing the information in a manner that's useful for us. And then the next following slides are just representations of the work that we've done. So we'll just kind of go through that. The one, of course, is a sun use item, but just some of the social media. Next slide, please. And then just more of that same messaging that we pushed out. And you can see the different social media that was used. And that's the end of my part of the presentation.
Thank you, Jamie. Councilor Sorg, you had something you wanted to say?
Yes, Mr. Mayor. First of all, let me say this whole effort that the PIO and Jamie has been doing is quite outstanding. I was very impressed. But as you saw in one of the slides, this coming week is coming up as Earth Day. And ever since President Trump has been in office, there's been a committee in the city here to celebrate Earth Day called March for Science. And I don't have any choice or not, preference, I should say, in what I'm about to say. I just want to get the rest of the council's opinion on it. They have been planning for a March for Science for, I don't know, almost a whole year. And, oh, I got to get the right email here. There we go. And they were going to postpone or cancel, I should say, this year's celebration. But it was suggested, and I'm not here, darn it. Wait a minute. I'll get it here yet. The idea was that marchers would gather around the downtown marching route, standing 8 feet apart, wearing bandanas, masks, and holding signs that inform the people of the seriousness of the pandemic and the need for science literacy. And so I told them I would just present it to the council to see what you say, and I would report back to them. Thank you, Mayor.
Thank you, Councilor. Mayor Pro Tem Gandara?
Thank you, Mayor. Thank you so much to Udell and Jamie. Very impressive. Thank you for always being considerate and respectful and listening to at least my remarks and suggestions. I very much appreciate that. I do want to, just as a food for thought, is working, and I'm sure that you are, with Natalie Green and all our contracts that we have with the various nonprofits I'm wondering if that is a part of that email string, with any kind of information that we have that's being shared specifically to those groups, and especially to the point about technology and the digital divide, and folks, especially in our impoverished communities, not having access to that, and looking at ways by which we can work like with entities such as Community Action Agency, Doniana Communities United, with their time banking program and the various things that they're trying to do to encourage not only, social distancing, but using the time banking model to reach out to folks that find themselves more isolated, which in turn leads to, depression and anxiety and those things. In addition, I want to remind folks that the schools actually said via Dr. Trujillo that they would be willing to put out any of these messages on their, not only their website, but their Canvas. They have such a huge following of people that we may not otherwise engage. And so I just want to remind them of that opportunity that they had indicated. And let me see, I wrote down a few other things. Let's see. I think that's it. So I very much appreciate that. I'm really looking forward to the reach that we'll be getting through utilities, the bills, the PSAs to the radio stations. I'm also wondering how we're working with the county and their bus system to put out some of these things, and just sharing in the comments of what, and although it's pretty minimal compared to some of the other things that probably we do, but I'm wondering what kind of communication have we had with them in sharing sort of the messaging.
Pro Tem, it's Udell. As far as sharing the messaging with the county, one of the things we did was provide them all the scripts, and are making available the videos that the council did if they want to push that out on their websites. And this being some of the communities, Hatch, Mistia, Sunland Park, all of those communities have access to this if they want to use it.
Thanks, Udell.
Thank you. I really appreciate that. I think here is a real opportunity to coordinate and collaborate. I know that Udell, I've asked to put sort of these messages and phone numbers, and I'm still going to ask, especially around domestic violence. I think the idea of doing sort of an interview remotely with La Casa's executive director would probably be very beneficial at this point as we move forward. I know you were specifically focusing on getting these 30-second messages out, but I really, again, want to reiterate the importance of awareness around domestic violence, and just as I'm reading through reports and the news, we're seeing such an increase with that and child abuse. And again, people suffering from anxiety and depression. So I just want to make sure that that hasn't gotten lost in all of this. I think it would be really important to do some remote interviews with some of our folks that are trusted in the community, and that could really, it can mean the difference of saving a life, frankly. And so I want to make sure that I say that.
Okay, well, thank you, Mayor Pro Tem. Councilor Beta-Stubbe.
Thank you, Mayor. Thank you, Udell, and thank you, Jamie, for that presentation, for helping out. I'm glad to see this information going out to the public. As we move forward, I think it'll be really good to also showcase how the city has been able to help with our community too. So if we do, and I'm assuming We're going to get some numbers on some of the programming that we funded, even from like Casa de Peregrinos, how many people have been fed, the numbers out on how many of our seniors are being fed by the city, those types of numbers. I think it's really good for that transparency's sake to see that the city has been active, has been responsive. We've had tons of employees that have been working tirelessly every day for our community. And so I think those are some items that it would be good to be able to showcase. And I'd like to be able to showcase those to my constituents as well. Thank you.
Okay. Well, great presentation, Udell and Jamie. Thank you for that information. Very comprehensive and really exciting to see all the different avenues that you're taking. So,
Mr. Mayor, can I respond to Councilor Sorg real quick?
Oh, sure.
I think Councilor Sorg, thanks for bringing that. I would highly encourage people not to do that. I think that a lot of folks, a lot of events that people have been planning for a long time have been postponed or canceled for good reason. I don't know if you noticed that there were recently protests in Michigan that were incredibly irresponsible, and perhaps the content of the signs would be different, but I think the level of responsibility is still important to note. So I've noticed people having protests in their cars and their vehicles. Perhaps that's an option, but I would highly encourage people not to gather in large groups during this time.
Thank you, Councilor.
I'll pass that on.
Okay. All right. Well, if there's nothing further, thank you everyone for your presentations. Great meeting as usual. Looks like we might not have a meeting next Friday. So it looks like we'll go back to our regular scheduled meetings on Mondays. So unless something comes up, then I'll call another meeting on Friday. But it doesn't look like at the time. We'll get a lot of this information that Councilors Vasquez and Bencomo had asked about. And so, David, yes. David Maestas.
Yes,
a lot of
sir.
Davids.
Yeah, sorry about that, Mayor. We will have to have a special meeting next week. The 14 days for the emergency proclamation will come to an end, so we need to work on extending that.
Gotcha.
And then also, staff is working on bringing forward the resolution for public comment at these type of Zoom meetings, and they will have that to present to council for review.
Okay, so let's see. Then that would be, what day is that? The 24th?
24th.
Okay, 9:30. Okay, sounds good.
Mayor, and if I may.
Yes, Mayor Pro Tem.
I just want to encourage us. I know this is an extra a meeting. I've gotten positive feedback about our special meetings and the way by which we have responded to this. People have really been very impressed with the city, and I want to encourage us to continue to meet as this, especially the surge and the peak. I think people are really looking to this, to us as a way or a vehicle to get information. And I think it's important to Councilor Abetastuvi's comments about this idea of transparency in terms of the funding that we are giving out, how many people are we feeding and helping. I think those are things that are really important and that we should use these special meetings to report out. So,
okay, you got it. Sounds good. Okay, entertain a motion to adjourn.
So moved.
Second. Motion made by Councilor Bencomo, second by Councilor Vasquez, I believe. Is that correct? Okay.
That's right.
All those in favor signify by saying aye.
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 Opposed? Okay, looks like we're adjourned. It's 12:20 p.m.
Thank you, everybody.
Stay safe. Have a good weekend.
Thank you, everybody. Bye.